Thanks for the lift, guys.
Welcome to the WOW Show. I bet you think the NHS is all about doctors, nurses, and hospitals, right? Wrong. There's an army of skillful and dedicated practitioners who play a vital role across our health service. They're called Allied Health Professionals, or AHPs for short. There's over 150,000 of them, working in hospitals, patients' homes, clinic, surgeries, and schools. They're helping change millions of lives for the better. There are 14 different allied health professions. You could be a music therapist, or an art therapist. You could choose to be a drama therapist, or not to be. That is the question. Or how about a dietitian? There's occupational therapists, operating department practitioners, osteopaths, orthoptists. There are paramedics, podiatrists, prosthetists and orthotists, radiographers,
speech and language therapist.
And let's not forget physiotherapists, like me. So, as an allied health professional, you could be working in any one of a huge range of fantastic roles. Later in the show, we'll find out a lot more about these exciting professions. And with the help of a panel of experts, we'll be able to answer some of your questions. But first up, what have Harry Kane, Darcy Bussell, and Mo Farah got in common? Yep, they all have famous feet. But what about our own feet? We often take them for granted until there's a problem, and that's when we need a podiatrist.
I'm a Great Britain age grouper in triathlon, a silver and bronze European medalist over sprint and Olympic distance. It puts a lot of strain on the body, especially the feet.
Well, as a podiatrist that's very much specialised in the sports injury, I see a lot of runners, Premier League footballers, golfers, cricket players, triathletes.
Because of the orthotics, I'm running better, like I'm not having weaknesses or injuries like I was, so I'm getting stronger and faster.
Podiatrist is a specialist in all things to do with the foot, whether that's the circulation, the joints and muscles of the feet. The feet are an amazing piece of your anatomy that, if they're not functioning right, can really affect your quality of life. As a podiatrist, you can work in a hospital setting, out in community clinics, or even visiting patients at home, or like myself, set up a sports injury clinic. I would assess a patient and decide what they needed. I might need to use my prescribing qualifications, some nail surgery to help them. It could be orthotic therapy, where we prescribe insoles to help people's feet. Because I specialise using a gait scan pressure plate system, diabetics and your high-risk patients that are struggling to get the right orthotic prescription want to come and see me to see if we can offload pressures that are causing them problems with their feet. So the last few years, I've definitely started to use social media more. A lot of new patients have found me through social media just by sharing what I do in clinic. I'm a runner myself, so I tend to share things in terms of injury prevention and management. Definitely social media now has become part of my job in terms of encouraging people to see what podiatrists do. Every day is completely different. The patients that I see are completely different. The sports patients are perfect for me because they'll come in very frustrated or down because they're injured. And as a podiatrist, I feel like I definitely make a contribution to fixing them and getting them back doing what they love.
Hey, what's up? Sorry, I was miles away there. Yep, music, along with art and drama, can affect us deeply, and all three of these are used by professional therapists to improve people's emotional health and well-being. Check this out. Music therapists use music to help their patients open up and express their emotions through sounds. Music helps develop communication, confidence, and self-awareness. Music therapists build relationships without using words, allowing anyone to access it. It isn't about teaching clients to actually sing or play an instrument. It's about communicating through improvised music with real instruments and the voice. For anyone affected by a learning disability, mental health issue, or physical illness, or finding it difficult to express emotions, working with music therapists can literally be life-changing. Art therapy uses creative and psychological techniques to help people who have experienced distressing or traumatic life events or live with life-limiting conditions. Art therapists need a degree or experience in art and use a range of creative techniques, but clients don't need to be good at art. Art therapists work alongside their clients to explore the meaning of their artworks and to support self-awareness and resilience. Drama therapists too thrive on helping others with their feelings. They use improvisation, movement and storytelling to engage with their clients. This provides a safe environment to help people communicate difficult feelings. For some people, acting out their experiences is much easier than directly talking about it. As a drama therapist, you work with clients who have a broad range of difficulties, such as psychological and mental health issues, physical and learning disabilities.
Hi, I'm Anne, and I'm here to see the radiography team today. All I know is that they use x-rays, so let's go and find out more. So what are you doing here?
Today we've just done a chest x-ray of this patient.
So can you tell me what I can see here?
These are her 2 lungs, and this is the patient's heart. This is air in her stomach. If there's something wrong, usually we'd write a red dot, and then we call up the doctors to let them know.
Perfect. So we're going to do a scan of your chest today.
So Tom, you're a diagnostic radiographer. What does that mean?
So our job is to create images of patients with potentially illnesses or serious life-threatening conditions.
So you've got loads of cool equipment here. Can you tell me a bit more about it?
So this is a CT scanner. It uses X-rays to create 3D pictures of patients. We also use X-rays, magnets, as well as ultrasounds.
What surprised you the most about your role?
I was not aware that we had to go to theatre as part of our job to help out with broken bones and things like this.
Thank you, Tom. So now I'm going to see the therapeutic radiography team.
Enjoy, bye.
I was with the diagnostic radiographers. You're a therapeutic radiographer. What's the difference?
So diagnostic radiographer is more about the imaging of patients, and a therapeutic radiographer is the treatment mainly of cancer patients, and we use high energy x-rays to deliver that treatment.
So you can use radiotherapy to treat cancer. Can you tell me how that works?
It's high energy radiation, so it can penetrate the skin. Radiation that we give is absorbed by the body. The normal cells have the ability to repair from the damage, whereas cancer cells don't have the ability to repair from that damage.
We're really lucky in this department to have proton therapy opening in 2020, but also the Christie's in Manchester have it, and they're already up and running.
So I've learnt so much today. I didn't realise there were 2 different radiographer roles and how varied they both are.
Want to know what it's like being a student AHP? Let's meet some of them.
You don't have to have all A stars to get to where you want to be if you want to be an allied health professional. Find whatever it is you're strong at and whatever you feel the most passionate about and go with that.
Don't let anyone tell you that you can't do it. I got told in school that I'd never go to university and that I was making things difficult for myself applying for physiotherapy. Although I didn't do that as my first degree, I've achieved it eventually.
I would just look into different opportunities. There are apprenticeships, there are university courses. There's something for everyone who wants to get into an allied health profession.
You can be the difference between good care and bad care, and the way that the patient receives that experience.
And you still sort of got that feeling sort of like in your chest that, like, you know, I've done something to help someone. I'm part of something good.
Break your arm playing rugby like I did, or go down with the flu? People can clearly see there's something wrong. But mental health, that's not always so obvious. It can affect the way you feel and the way you behave. That's where occupational therapists like Usman Ali come in, helping people to live the best lives they can.
Jason is an individual that I've worked with who has experienced anxiety. He was avoiding going outdoors, avoiding any kind of interactions with people who he didn't know. So looked at what he thought his barriers were to engaging, and then we set what we call SMART goals: specific, measurable, achievable, realistic and time goals. How are you feeling about going into the shop?
Yeah, not too bad.
So we started very simple, which was getting out to the front door, and then we've built on that to getting into the local shops to then be able to go into the local shopping centre independently, which is what our end goal is with Jason.
Cheers, pal. Thank you very much.
Occupational therapy is a profession in which we focus on activities and occupation as a means of enabling people to promote their independence and improve their quality of life. We can work in a range of different clinical areas. So at the minute I work in the community mental health team. People often assume occupations are jobs, but for an occupational therapist, the occupation is about the activity. So that can be broken down into 3 different areas. Self-care, that can include washing and dressing on a morning. Productivity, work would come into the productivity as well, and then leisure as well. So what do they enjoy doing? What I enjoy most about my job is working with the people. Obviously we've got the stool, we've measured it to make sure it's the right height. How has that helped you? Or
it's a gem. I never thought I'd need one, but I do. It's independence. It's all mind over matter as well.
It's fun. It's really meaningful when you support someone to achieve their goals and increase their independence and their quality of life.
Well, I call him Superman. I know I'm nowhere near that as confident as I was, but I'm on my way, and that's thanks to husband.
Do you have great interpersonal skills, patience and dedication? If so, physiotherapy might just be for you. As a physiotherapist, you'll treat people with physical and mental health problems caused by illness, injury, disability or ageing. You'll be assessing patients' problems and coming up with the right kind of treatment or programme to suit their needs. As well as treating patients with things like exercise or hands-on therapies, you'll be helping get them back to living the life they want to. Osteopaths are hands-on, regularly using a wide range of techniques that focus on releasing tension, stretching and massage to relieve pain, aid blood flow and help the body's own healing mechanisms. Osteopaths take a holistic approach. It's based on the principle that a patient's health depends on everything: the skeleton, muscles, ligaments and tissues, all functioning smoothly together. It's possible that you've never even heard of prosthetics and orthotics, but as well as being a pretty good tongue twister, this area makes for a really interesting career. Prosthetists design and fit artificial replacements for people who have lost or were born without limbs. This, of course, gives freedom and independence, enabling people to work, live and play. Orthotists will treat people of all ages with a physical problem. They assess how you move, diagnose mechanical problems, and prescribe, measure, and then customise a brace to fit your body. These orthoses are used to support the spine or limbs to relieve pain and assist movement. Training as a prosthetist or orthotist will provide you with the skills to make a lifelong difference to people's lives. You'll learn about linking anatomy, physiology, biomechanics, and even engineering. And you'll find out the huge impact that these amazing appliances can have on a person's life.
Some people are obsessed with food. Apart from giving us pretty pictures, food is vital for our health. But it can be confusing. There's a lot of information out there about what is and isn't good for us. Dietitians understand the science behind what we eat, and they use this to help people make the right choices for their health.
As a teenage and young adult dietitian, I've set up these cookery classes called Eat It Better. We chat about what a balanced diet is and how to achieve that. And then we all learn to cook a couple of dishes together. It seems to have worked really well. Dietitians are qualified health professionals who work with individuals to improve their diet. We play a huge role in prevention, making sure people are following the right diet because that can prevent chronic diseases like heart disease or diabetes. I'm a haematology dietitian, and that means that I work with people who've been diagnosed with blood cancer. I'm just going to go through a few things about your diet.
Monica's been there from the very beginning, and she's helped me to not only regulate my diet and gain weight, but she's also helped me with managing my side effects. Monica gives me advice and printouts of different food groups. I create like plans for the week of things that I would eat.
When someone's on the ward, they quite often lose their appetite or they feel sick. But the thing is, it's so important to keep eating because without the food, you're not going to be able to get better, essentially. So it's trying to work with people to figure out ways where they can eat more. Sometimes we use special nutritional supplement drinks, which have extra vitamins and minerals in. I think what I really like about this job is it's so varied. I work with the media, I've put together different things for journalists or worked on a couple of programs. I work with different charities, so I've written some diet information for them. So it just really keeps you on your toes. I don't think I could ever have done a desk job. You're always moving around and you're interacting, so the days fly by and I don't think I'm ever bored. It's such a great job. You can go home every day and you feel like you've actually made a difference to people's lives.
Believe it or not, 2.5 million people in the UK suffer from speech or language difficulties. This can lead to feelings of isolation and educational problems, but with the right help, these issues can be overcome. And that's where speech and language therapists come in. They work with children whose speech is slow to develop, people with a stammer, or the elderly whose ability to speak may be impaired by illness. Speech therapists work in hospitals, community clinics, and patients' homes. If you have excellent communication skills and enjoy helping others, this could be the ideal job for you. Working as a paramedic is not all blue flashing lights and high-speed driving, but it's still a pretty exciting career choice. Paramedics are medical professionals who specialise in emergency response. They have to make quick decisions that can literally mean the difference between life and death. Modern paramedics can be found in a variety of different roles and places, such as GP surgeries, sporting events, or working for search and rescue. You're forgiven if you've never heard of an orthoptist before. Orthoptists diagnose and treat people with issues that affect eye movement and visual development. These can be caused by problems with brain development or brain control of the eyes. Orthoptists help the eyes work together again as a pair. As an orthoptist, you'll usually be part of the hospital eye team, but may work on the wards, in community healthcare, or in schools. But wherever you work, you'll make a real difference to people's lives.
Imagine what it's like to have an operation. Scary, right? Well, help is at hand. There are these amazing people called Operating Department Practitioners, or ODPs for short. They're with the patient before, during, and after their operation. They're experts in what goes on in the operating theatre and a friendly face.
The ODPs are a key member of the team. You need to be able to react to difficult situations, have a really close eye on the patient, who is the #1 priority.
My main aim is to provide patient safety and welfare. On a normal working day, I'm based as an anesthetic ODP, so I'll be working most of the time with nurses and anaesthetists. But you could work in accident and emergency, intensive care unit, surgery and recovery. Normally, a patient comes in really shy, scared at the same time, so we talk about their favorite subjects at school, favorite food they're gonna have, just to distract them. I want them to feel comfortable. When the patient's asleep, we go straight in the theatre, transfer the patient into the operating table and perform the procedure. I need to assist the anaesthetist and basically maintain patient safety. But if you're an ODP on the scrub side, you'll be assisting surgeons, so you'll be more past instruments to the surgeon. They have to count the instrument to make sure that there's no instrument left inside the patient. As an ODP, I think you have to be compassionate, hardworking, dedicated, respectful, and able to work in multidisciplinary team. The best bit of my job is knowing that the patient are all fine and okay by the end of the procedure.
It was nice because before he was distracting me when they were putting needles in my hand. I knew who he was afterwards when I was really tired, which was nice.
ODP job is very rewarding. Being appreciated by my team members, the parents and the patients themselves is very fulfilling.
So, as we've seen, there are a lot of different careers, no matter what your ambition or your aspirations. I'm sure you've got a lot of questions now too. We're linked up with Richmond Park Academy in South West London. Hi there. Give us a wave, guys. And also Unity City Academy in Middlesbrough. Hey everyone. But anyone can ask a question. Just drop us an email or give us a tweet. In the studio, we've got our panel of experts. We've got the lovely Marie-Claire, we've got Michelle, and we've got James. So first up, we're heading to Unity City Academy in Middlesbrough.
Are there any available jobs in the sector?
Okay. Marie-Claire, do you want to take that one?
Sorry, I missed the first part of it.
Are there many available jobs in the sectors for AHPs at the moment?
There's a world of opportunity out there with that, with occupational therapy through to podiatry through to drama therapy. You've just got to go and knock on the doors and find out.
Awesome. I hope that answers your question. We're going to head over now. We're going to go to Richmond Park Academy in London.
I'm a bit squeamish about hospitals and injuries. Does that matter?
All right, good question. Michelle, what do you think?
No, it doesn't. And there's such a range of different roles within the AHP profession that you may be working out in the community, you may be working in a GP surgery where you don't see anything squeamish at all. There is the flip side of that where, yes, you might be working as perhaps a diagnostic radiographer in accident emergency and you do see some things that are a little bit gory, but then you get to train and learn on the job and get used to that if it's a problem for you. But again, as I said, if you are squeamish, there's lots of work out there within AHPs where you don't ever come into contact with anything that would perhaps be a little bit uncomfortable.
All right, great answer. Thank you very much. Now we're going to come over for our next question.
How can you get in the healthcare profession with good skills but not the right qualifications?
Okay, great question. I think, James, you're probably going to answer that for us.
Yeah, thank you. Yeah, great question. I think there's a whole range of different options that are available to you. You can start by looking at access courses that would get you into a university degree programme. You can look at apprenticeship models, and that works all the way through from a support worker level role at sort of at the very early stage of developing your career, all the way through to a graduate role at sort of a graduation point for degree level training, and then all the way through there as well through to master's level and doctoral level training as well. So there's lots of different entry points along that system that you could use.
Awesome. Marie-Claire, anything you'd like to add on that one?
Yes, absolutely. I started my life just as a voluntary physiotherapy assistant in the local hospital. I went and knocked on some doors. From that job, I then got offered a permanent post as what was then an assistant, which is now an associate. And these support worker roles are so important, and they're throughout all of the AHP or allied health professions. And then from that, I decided after 2 years that although I had no formal qualifications and I had no A-levels, I thought, this is really the career for me. I'm absolutely passionate about it. So I took myself off and I went and did an access course, which was hard, but I got into university and I graduated, and 10 years later I went on and did a master's, and now I find myself clinically working as well as working in a fellowship with Health Education England. There are such vast opportunities out there for allied health professionals to not just be a clinician, but also for the support workers. They are equally as important to each of those allied health professions, and they play a vital role. And then they have lots of different names. So rehab assistants, support workers, technical rehab assistants. There's lots of different things out there. So don't let anyone stop you.
Fantastic. Thank you for sharing that story, Marie-Claire. And I hope that answers your question. Let's take another question now.
How much can I earn as an AHP?
Okay, that's a great question. I want to know the answer to this. James, Michelle?
Yeah, sure. I mean, I think it's worth looking at the breadth of opportunities that exist there. So if you go into an NHS role, the likelihood is you'll probably start on a if you go in at a graduate level at a band 5 salary, that'll be something in the region of £19,000 to £20,000 per year, and then you'll work up through the grading system as your experience and your qualifications develop. If you work in the private sector, you know, it's really based on how much you're willing to work. I mean, if you look in podiatry as an example, private podiatrists are earning between £50,000–60,000 per year, some even more than that, and those that own their own private clinics can earn in the hundreds of thousands. So it really depends what your motivation is and what sector you want to work in. I suppose the really key message though is, as we move forward as a sector, it's really important that we get people working in all parts of the sector. So it's probably worth thinking about a portfolio career in that sense, that you take on some NHS work and you do some work that really helps develop your clinical practice and develop in that area, but then you also do some private work as well, and mix that up with, as the guys have said, research, educational work in the commercials industry. You know, there's so much opportunity there that you can really go in lots of different directions.
Awesome. So there's a really wide variety of ways we can get involved. So I hope that answers your question. I think now we're going to head to Richmond Park and get another question from you guys. Oh, Unity City. Hey guys.
What voluntary work would be good if I was interested in health and social care?
Okay, great question again. Michelle, do you want to get that one?
Yeah, sure. So I would recommend that you reach out somewhere that's local to you where they're caring for patients. So you could look at nursing homes, you could attend open events that you see at your local hospital clinics, community areas, perhaps reach out to charities, anything where you're connecting with people, learning how to talk to people, build confidence and skills and wanting to care for people. So as well as reaching out to local hospitals, because there are voluntary opportunities there in cafes or, as I said, with charitable organisations within those hospitals. So if anyone tells you you can't get voluntary work, then don't take no for an answer and just get out there and knock on doors.
Great. That's a really, really good answer. I think as long as you've got that motivation and determination, you'll find the right place. All right, let's take another question now from Richmond Park.
Is it possible to get work experience as an allied health professional?
Sure. How about Mary Claire? What do you think?
Yes, and again, it's really important that you talk to clinicians, you go and meet the local departments, and don't forget, it's not just in the hospitals. You can do these in care homes, you can do these in nursing homes, you can do these in specialist school settings. Everywhere you look around, your environment is somewhere where someone cares for someone. So my key piece of advice would be, don't let anyone stop you.
Great, fantastic. We're going to take a question that's come in on the email now from Sue in Manchester, and I think, Michelle, this is going to be a good one for you. Sue asks, what qualities do you need for a career as an AHP?
Well, I think first and foremost, it's really important to want to work with people, whether that's the patients and the families you're looking after, or the your team colleagues, because we work with all other, as a therapeutic radiographer, I work with other allied health professionals and doctors, nurses, support workers, porters, etc. in the hospital environment or clinics. Other qualities, it's about being conscientious. So even if you're unsure in the early days of your school studies or when you go on to train, it's about really just being committed to your work. And I have no doubt that if you're interested in healthcare, you'll do that. It's being resilient as well. And, you know, you've got to balance the about 50-50 split of working out training in a hospital and also being in the university environment. But the important thing to remember is it's huge fun out there. There's lots of things to learn and it's hugely rewarding. So I don't think you'd have any doubts about how motivated you want to be once you get onto the training courses. So yeah, that's kind of a summary of the skills. And also remember there's lots of transferable skills. I never expected to get involved in business studies or service management, but it's a way where my career took me. I worked in an academic setting within a university teaching young people and mature students. So look out for the resources as well. There's the Healthcare Careers website and also the I See the Difference website. All our professional bodies who lead what we do in our areas of practice have lots of information, so reach out to those two and do your research to find out what you want to do.
Brilliant. Thanks for that information, Michelle. We're going to take another question now from Unity City Academy in Middlesbrough.
What's one of the hardest things you've ever done in your career?
Oh, good question. James, what do you reckon?
Hardest thing, I suppose, dealing. Sometimes it's the peaks and troughs of clinical activity. I think sometimes you get involved in very intense periods of clinical activity, and you could be in a high risk lower limb clinic where you're seeing several patients one after the other, and they all have complex needs and a range of different medical conditions, and you can contrast that with working in a sporting environment. If you look at podiatrists and physiotherapists and others that work as part of medical teams for London Marathon, for instance, there's the great influx of runners and different points in the run. That can be really challenging to try and deal with all these different people all at the same time. But we all, I think, have reflected back on the rewarding nature of all of this activity that we engage in. It's such a wonderful place to be part of this AHP world, and for anybody that's thinking about it, the difficulty that you face is completely offset and overwhelmed by the benefit that you get back out of it. So it's really worth thinking about.
Awesome. Marie-Claire, I think you've got something to add in there, have you?
Yeah, I think there's also something around, for me, one of the hardest things with the boundaries that sometimes the system provides us, and actually working with my allied health professional colleagues and working in multidisciplinary teams and trying to break down those boundaries to make sure that patients are at the centre of our care is probably one of my hardest things, and also the amount of paperwork, particularly in the NHS.
Awesome. Thank you for that answer. And thank you very much for that question. But I'm sorry, we're going to have to end it there. Thank you to everyone who has asked a question so far. The panel will be online for the next hour or so keep those questions coming and we'll do our best to answer them all. And teachers in the back, remember, we've got lesson plans and resource packs and progression packs which you can find on our website, thewowshow.org. But for now, thank you very much everyone. For everyone who took part, goodbye.